these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office. Experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all. In-depth discussions.
Breaking it down into simple terms. We hold these truths.
We hold these truths.
With Dan Crenshaw.
The Eagle has landed.
Welcome back, everybody. We've got a great show today. It is on probably the most important topic in America right now, which is healthcare. And to help us with that discussion, I've got Dr. Nicole Saphier. She's a full-time physician in New York City, of all places. Also a regular contributor to Fox News, talking healthcare issues. And I've got her book right in front of me, Make America Healthy Again, How Bad Behavior in Big Government Caused a $1 trillion crisis. And we're going to jump into that book. But first, Nicole, thanks so much for being on the show.
Absolutely. Love being on.
And I want to jump into this book. There's a lot of really good stuff in here about why healthcare costs so much and how our behaviors have contributed to this, how technological innovation plays a part in all of this, how the ACA has played a part, and how we can fix it. But first, like I said in the intro, you're a doctor in New York City right now. So what's that been like, and how do we get out of this?
Well, New York City being the epicenter of the crisis in the United States, definitely has seen the brunt of it, but that's largely due to a very dense population. And we're in crisis mode for the last 6-7 weeks, and rightfully so. You have this novel coronavirus from a foreign country we knew nothing about. So the right thing to do, the intelligible thing to do, is to shut everything down until we get more information. And that's exactly what happened. We knew that our hospital systems were already functioning at near max capacity because under Governor Cuomo, we had a lot of hospital systems shut down while he expanded Medicaid. So that left us with a deficit of hospital beds. And so that is why you had to see those makeshift hospitals coming into Central Park and on the Navy ships. And, luckily we had more beds than we needed, more ventilators than we needed. But, it was very concerning in the beginning. We didn't necessarily know what to do. And, unfortunately, one consequence of that is that, we had to stop caring for a lot of non-COVID patients in the interim. So I am eager to get back to making sure we're caring for everyone and not just COVID patients.
Are we getting back quickly enough? I know we just changed some rules in Texas to be able to see non-COVID-19 patients. I in my opinion, coming from Texas, in my humble opinion, we never should have had that rule to begin with. Our hospitals have been empty this whole time. And I've been very frustrated by that. And, they make it seem like, hey, we're just not letting anybody get a nose job. Well, that's not the case. Like there's heart procedures not happening. You're a cancer doctor, so there's cancer procedures not happening, right?
Well, so, I have a very good friend of mine is a family practitioner in West Texas, San Angelo, Texas, and they were prepared too. They shut everything down. And just as you're saying, they had empty ICU beds, empty hospital beds, just waiting for this wave of COVID patients. Now, let me tell you, in New York and New Jersey, where I am, that was not the case. We had to convert operating rooms and different floors to make sure that we can take care of all these COVID patients. So, it really wasn't a one-size-fits-all approach, and we did what needed to be done in the beginning. But, that being said, I can, throughout the country, in Texas for one of them, I think the state legislators more precisely, really inserted themselves and made some decisions that I don't necessarily believe were in the best interest for the patients. So I am happy to hear that certain states, such as Texas and even in the Northeast, they're going to start loosening up some of those restrictions on those non-essential / essential surgeries, because as you alluded, it's very gray what an essential, non-essential, or elective surgery is, because they were saying that was only an elective surgery was anything that was coming into the emergency room, essentially. But think of it this way. That means that a cancer surgery was considered to be an elective procedure, or a brain aneurysm embolization was considered an elective surgery. But the truth is, cancer and a ruptured brain aneurysm carry a far greater mortality than COVID-19 does. So, unfortunately, the decision-making was taken away from physicians and was put into hospital administrators' hands and state legislators' hands.
Yeah, that's exactly what happened. And I would talk to doctors who would be saying, we are severely overreacting here from a policy perspective. Again, in Texas, and I'm not saying that about New York, very different situations, but in Texas, it was very obvious that we were overreacting, and the administrators had a totally different take on this. And I'm just not sure why they have such different incentives to make decisions. I think it's just completely about a liability issue for them. I don't know. But revenues are going down, which affects our entire healthcare system. Some of these smaller practices run the risk of going out of business because they're not allowed to see patients, and they're just like, why can't we see patients? This is ridiculous. Our legislature here in Texas, they were very much against the regulation, but our governor also has to hear from and that was actually bipartisanship being against this. It was amazing. Bipartisanship actually works fairly well in Texas government. You'd be surprised. And it kind of begs this other question, which is, do some of our political leaders have they been listening too much to just a specific set of folks in white lab coats and not enough to a more diverse set of opinions?
Well, I mean, that's an interesting thought. And the truth is, I think political leaders listen more to the lobbyists for the larger associations, specifically hospital associations, than really getting to the crux of the medical physicians and the expert personnel. Because I can tell you, if they were listening to the outpatient primary care doctors here in New Jersey, they would have given them a lot more resources to help test and manage patients in an outpatient setting than before they got into the hospital. Unfortunately, you mentioned that the hospital systems, they are already running at a very thin margin as it is right now. And so to halt all of these elective procedures is detrimental to the hospital. But don't forget, the hospital is actually getting paid more per COVID patient than some of the other patients. It's really the physicians and the nurses and those that contract with the hospital who aren't allowed to be bringing their elective cases in there who are really hurting. And that's the biggest problem that I had under the Affordable Care Act, was it really pushed out a lot of these small medical practices. And in my opinion, what we've been seeing with COVID-19 is only doing that even more. You're having your small standing outpatient centers, outpatient physicians who are going to be struggling more than anybody else. And that will only affect healthcare detrimentally in the future. Yeah,
because the other option is you go back to the hospital for that outpatient care, and it's just always more expensive.
Right. And that's why our hospital system was already near full capacity when COVID-19 started to hit, which is why we had to make makeshift hospitals.
Yeah. And you mentioned something about expanding Medicaid as a reason why we had less beds in New York. So I took note of that. I wanted to actually go back to that and have you explain it. So some states obviously took the Medicaid expansion under the ACA. Some states like Texas did not. So can you expand on that point? Because it was made very quickly, but it's an important one.
Well, so Governor Cuomo, when they were making the decision to expand Medicaid, he very clearly said that he acknowledged hospitals would close and they would have fewer hospital beds so that they could expand Medicaid. And just like the Affordable Care Act, those endeavors are altruistic at best. They are trying to do what they believe is right for the overall population. However, there are consequences when you do that. When you expand Medicaid, or when you are going to, even discussing single payer plans or the Affordable Care Act, all that is doing is giving funding to supply a plastic insurance card. They're giving access to healthcare, but they're not actually increasing the supply of that healthcare. They're not doing what's necessary to make sure those hospitals are still able to run and care for patients, or to make sure that there are enough physicians to care for these patients. Because in fact, we have fewer physicians and nurses who are wanting to go into training right now because of decreased reimbursements and the administrative burden. So they're only working on supplying that insurance card, not necessarily giving the resources for the supply of the equation. And they certainly aren't focusing on the demand of said equation. They are just handing out the insurance cards. They're not actually incentivizing any healthier behaviors to lessen the overall cost burden of healthcare.
Right. So it's paper access, not physical access to healthcare, which is a very important distinction. But what are the economics behind that? So, when Governor Cuomo acknowledged there'd be less beds and less hospital space as he expanded Medicaid, help people understand, why is that? Like, why would that happen?
So that he had to figure out where can he reallocate money. He wanted the money to go to provide more Medicaid insurance cards and coverage for that certain population. And so by doing that, it's not that there was an abundance of money. They had to take from somewhere else. And that somewhere else came from, well, one, they took more taxpayer dollars, but they also, what they did was they took away from reimbursement of other programs. Specifically, they cut reimbursements to certain hospitals, to certain physicians for certain procedures, and they took away from other programs, which ultimately have left some of the smaller independent hospitals who are already on a very thin margin. It really forced them to close. A lot of those hospitals do depend on Medicaid and Medicare, whereas they don't have a lot of the privately insured at those hospitals. Mm-hmm. So if you continue to cut funding to them, being on such a narrow margin, they weren't able to stay afloat.
Interesting. See, you hear the counter argument often, which is no, if we increase Medicaid and these hospitals are using Medicaid as their reimbursement, then you would think that these hospitals would be better off. But in fact, it's not true. I guess just because the patient throughput doesn't change necessarily.
Well, so here's the problem is that you have Medicaid and Medicare pay a fraction of not only what private insurance pays, but what the actual cost of the care is. And so when people say that private insurance, charge or pays an egregious amount for certain procedures, it's like, well, it seems egregious when you actually are comparing them to the nominal reimbursements provided by Medicaid and Medicare. But the reason that certain physicians and certain hospitals are able to take Medicaid and Medicare is because it's offset by the private insurance.
Right. Yeah. It's such a complicated discussion. And, the one-liner in politics is usually, well, if you're against Medicaid, it's because you don't like poor people. In reality, it's a lot more complicated than that, and as demonstrated by some of these hospitals closing that are primarily for low-income people. And it should also be noted that the people we're trying to help the most get crowded out of the Medicaid system when you keep adding more people into that system, especially able-bodied workers.
And that's exactly right. And it's really easy to sound like the bad guy, but the bottom line is I personally believe that every American should have access to health care, but that does not equate to every person should have a health insurance card in that sense. And as you just said, the more people on Medicaid, the more rationing of care that will happen, because as Medicaid, the number of recipients increases, the reimbursements will continue to go down to cover all of those people, which means that the doctors and the hospital systems that are dedicated to just having Medicaid patients, if those reimbursements continue to go down, they will not be able to stay afloat.
I was going to save that discussion for the end of the interview, but you brought it up. So now I want to just hit on this. It's a more philosophical discussion, because this is what you said. You said you believe everybody should have access to health care. And I don't see any reason to disagree with that. Now, but when you say that, what would a Bernie Sanders supporter say? They would say, see, exactly, single payer healthcare system. That's exactly what you're saying. Thank you for agreeing with me. But it's not quite that simple. And they would also say, healthcare is a right. It's a right, like you just said it. Well, and to me, I'm like, no, we have to choose our words carefully. And I think the way you phrased it is correct. I don't see any reason to be against that. But when I say, and I think you say, everybody should have access to some kind of health care, I agree. But here's what we're not saying. We're not saying it's a right. We're not saying that I can force, because you're a doctor, I can't conscript you into government service because I'm the government and you're the doctor, right? So I can't say, Nicole, you have to work this many hours a day. You're going to get paid this much and you have to see this many patients. Good. And I can't make you do that. That would be absurd. And so and to call that a right would mean that I have to take away your rights to give somebody else a right. So that's the first problem with calling it a right. And also what you didn't say is it has to be free for everybody, and it can't be because nothing is free. And so what's the right? I guess so the question I'm getting at is from a principled standpoint, a philosophical standpoint, how should we look at healthcare? I think conservatives are accused too often of saying, oh, just let the free market take care of it. But there's some obvious problems with that with respect to healthcare. because it is somewhat of a luxury good, but we do want people to have access to it. So it can't be a purely free market system for obvious reasons. So, I mean, when you describe how our systems should generally look on the spectrum of libertarian free marketeering to socialist medicine, what do you think the right way is to describe the ideal healthcare system?
Well, so I go into, I discuss the historical trends and the evolution of our healthcare system in my book, because I think it's important for people to understand how we got to where we are right now. I personally support more of a free market system, the privatized healthcare. But for the people who support the single payer, the bottom line is, whether you're for single payer or for a completely privatized system, nothing is going to work on our current trajectory because of the large amount of chronic illness that is plaguing our country, that has overrun our entire healthcare system. And because of this, we are having limited financial resources to care for all of these patients with all of the chronic illness. And because of that, it's pushing us towards a single payer system, because people are getting so frustrated and people are finding that they can't afford such cost of care. But the truth is, we have found that we are really good at two things: medical innovation and, so our country is really good at medical innovation. We have more research and development, more cures, more technology than anywhere else in the world. Yet we complain when those things actually cost us more money. We're demanding a cure, but we complain when it costs money.
Right.
Well, the truth is, if you want to offset some of that cost, you have to decrease the demand for healthcare. And bottom line, when up to 80% of heart disease could potentially be prevented through certain lifestyle modifications, and maybe 40% of cancer could also be prevented with certain measures, that's telling me that our system is way overutilized, and there's no healthcare policy in the world that is going to make it better if we don't actually rein in the cost of care. Otherwise, we're going to have to get to a place of a single payer where we start rationing care for everyone, where we stop with our innovation, because at that point, we're just trying to tread water and keep people afloat, but we won't be leading the world anymore in our medical care.
Right. And I want to get into what are the different reasons that healthcare is so expensive, and it's not always what people think it is. But to the original question, it's if you move to a single payer system, and you talk about this a lot in your book, I've talked about it a ton. You have to be honest about the downsides, which is a complete lack of innovation and research and development. I think you had a stat somewhere in the book where well over 50% of drug innovation and research and development is from the United States. So, the rest of the world basically takes advantage of that and lives in our garage as a result. If we move to their kind of system, all of that would disappear. That would not be a good thing. And but on the free market side, again, if you just let people fend for themselves, if it's a purely free market system, then there are obviously people who fall through the cracks. And so how do we get the right mix of both? I think going forward is the question that policymakers really have to ask. And the biggest problem, as you've noted, our number one problem in the United States with healthcare, it's not lack of innovation, it's not lack of expertise. We actually have more hospital space and ventilators than any other country on a per capita basis. I've dove into those numbers before as we were comparing ourselves to other countries for the COVID-19 crisis. But what's our big problem? We spend a lot more on it per capita. We spend way, way, way more. And it's too expensive. It's too expensive for people to buy insurance. And so you go into a lot of detail on why that is. Okay. Is it drugs? Is it doctor pay? Is it administration pay? Is it the ACA? Is it these third parties? You mentioned technological innovation. That's a really interesting one that doesn't get talked about a whole lot, because we're always pushing for more technological innovation and that new therapy and that new drug and that new medical device. But it's like, well, it might cost $100,000 for a treatment, and people feel this real sense of unfairness that it costs that much, and because it's an emotional reaction, and they don't think back to what life was like before that, because medical care would be a lot cheaper if it was very, very simple. But obviously it's not. And then we keep getting newer things that make it better, but those things have to be paid for by somebody.
It would be a week-long episode if we were to discuss all of the factors that went into how our healthcare has evolved in such a complicated and costly system. And for me, there are so many things that are out of our control, but I want to bring to light to people that a lot of the things that have made our healthcare more expensive are a lot of the things that make it so incredible. And when you're talking about drug pricing. Now, are there some egregious profiteers out there? Absolutely. And I'm happy to highlight some of them like I did in my book, because yes, there are some people who are making an obscene amount of money on drug prices, but I can tell you it's very far and few between. A lot of the money for making pharmaceuticals are in all of the failed pharmaceuticals. Everyone's now becoming aware of some of that process with COVID-19. You see the clinical trials that are taking place. You see the trial and error in medications, but you have to know that years have gone into that development through laboratory research, animal research, and then human clinical trials. These cost millions of dollars, and the far minority of medications and technologies actually come to market. So tens of millions of dollars are wasted just trying to find that one breakthrough. And so at some point, yes, they do try and make up that profit. And, I don't want to get to a point where the government has to put price caps. I mean, Bernie Sanders suggested that pharmaceutical companies can only charge a certain percent above what the cost was to make it. But I don't know if that was just a feel-good number for him, because does he really take into account all of the money that was spent for all of their failed endeavors? My guess is probably not. Yeah. And so if he really is going to start restricting them, then all of a sudden you're not going to see the venture capital money go into any of these innovations. So there has to be other ways to bring down the cost of healthcare, and it can't just be on limiting profits for those that are actually supplying some of these breakthrough medications and technologies.
Yeah, you also note just as a percentage of healthcare spending, I don't have the numbers right in front of me, and it's multiple parts in your book. You note, how much does doctor pay actually account for total healthcare spending? How much do drug costs actually account for total healthcare spending? They can be double-digit percentages, but they're not huge.
Oh, absolutely not. And physicians, it's interesting. So, this is something that hits near and dear to my heart because, as a physician, we all know at least one of our colleagues who has suffered from burnout and likely at least one who's attempted suicide. I talk about a personal story, a couple of them in my book, but the bottom line is physicians are held to a very different standard than really any other profession in the world. I mean, no offense to politicians, but everybody kind of expects you to not really take our best interests in heart, which is sad to say because I think most of you do. But, people aren't surprised when something happens and a politician does it. They just say, oh, Washington. Mm-hmm. But physicians, they're held to another standard. All of a sudden, there's no room for human error, and they are expected to be 100% altruistic and not have profit on their mindset whatsoever. But at the end of the day, it's called a job for a reason, and we are all working to support our families and our homes. And so when a physician sends a bill to a patient for services rendered, it shouldn't necessarily be taken as an offense. It is services rendered. You aren't necessarily upset when you get a bill from, your plumber or your car mechanic or anybody else, but all of a sudden, physicians get a bad rap when they're trying to collect payment. I mean, that's why you start seeing these out-of-network bills going through. I mean, it's really muddied the water, and it's given physicians a bad look when the truth is it's not necessarily the physicians that have caused most of these problems. In fact, it's really been the insurance companies intruding, and the battle is between the insurance company and the physician, and the patient really needs to be left out of it.
Yeah, and there's just so much more emotion around healthcare. People, especially recently, are just being told constantly that it is a right, and so people feel kind of this injustice if they receive a bill. But that's not totally rational. I think it occurs because it's about your health, and you don't want that taken away from you, and that's totally understandable on the one hand. But on the other hand, we have to be thinking about how to make the system work. When it comes to costs, too, we talk about lifespan. Also, people are living so much longer, and the vast majority of our healthcare spending ends up going to keeping people alive longer. So it shouldn't. And this is just great to illuminate for people as we set up this discussion, like why healthcare is so expensive. And the truth is because, well, in years past, you would just die, right? And you don't need any healthcare if you're dead. But now we keep people alive, and we keep people alive for a lot longer. We keep people with chronic conditions alive for a lot longer. And then we use more expensive technologies to do all that. And as a result, our per capita spending is enormous. Now here's the counter argument that we would get, which is, okay, fine. Well, all of these other countries, Western countries, are living in the modern era too. And yet on a per capita basis, their spending is still far lower. Okay, so how do we respond to that? And you had a great example on if Ruth Bader Ginsburg had broken her hip in Canada versus the United States, and you compared what that care would have looked like for her, a Supreme Court justice in Canada versus the United States.
That's right. So I always have to give my disclaimer. I was in no way, shape, or form involved in the care of the notorious RBG. However, just based on the public reports, I made an observation that, she, I believe, fell and went and received care because they thought maybe she had a rib fracture. And the bottom line is she was able to get a CT scan. They found an incidental nodule, which turned out to be a lung cancer. She underwent surgery. She underwent radiation. And then she got back to work. And all of this happened in a very short amount of time. And so what I did was I actually highlighted, had she had the exact same occurrence happen in a nation outside of ours, such as Canada, which Bernie Sanders loves to talk about, how her course would have been different. And in the simplest forms, the bottom line is her lung cancer likely wouldn't have been diagnosed at such an early stage, and it wouldn't have been until she had a more aggressive form that it would potentially have been seen, because she likely wouldn't have gotten the CT scan. And even if she did, there would have been a significant delay in care that would have likely affected her outcome. She probably still would have lived because, we do have such advanced treatments, but the treatments would have been significantly more invasive. But there's a chance that it would have also affected her outcome. So it's really hard to say, but, it's you can't always compare apples to apples. And, I think that people really take for granted the healthcare system that we have here. And yes, it is less expensive in other countries, but that is, for some people, they feel it is okay to wait 6 weeks to get an MRI, or to be told by their government, like in the NHS, that, well, you can't have your hip replacement surgery because you're considered obese. And although I don't necessarily disagree with some of that mentality, they're not doing it because they're really trying to push their nation to be healthier. They're doing it because they can't afford to take care of everybody, and that is their way of rationing care. In my opinion, I don't believe any healthcare policy, whether you want to advocate for single payer or complete free market, I don't think anything is going to work unless we truly start focusing on how we're really going to make our nation healthier. The Affordable Care Act, for everyone that supported it, in one sense, it was altruistic again, at best. How can you argue with someone saying, we want to make sure every American has access to healthcare? Right. You can't, because if you do, you sound like the bad guy. However, here's what it did not do. It took away any incentive of positive lifestyle and healthier lifestyle behaviors, because it said, and by the way, the pre-existing conditions clause under it is the most popular bipartisan clause of it. But here's what that did. It took away the incentive to live a healthier life, because they said it doesn't matter what you do. It doesn't matter how you live your life, because whatever comes your way, everyone else is going to help pay for it. You are not going to have to pay more for it. Whether you want to smoke cigarettes, drink an abundance of alcohol, live a sedentary lifestyle, eat unhealthily, whatever secondary illness comes your way, everyone else is going to pay for it, including your neighbor next door who's doing everything they can to live a healthier life. And that's not right. You have to think about it like the whole seatbelt law. And I talk about that in the book, saying, doctors for decades were saying, to save lives, wear your seatbelt, adhere to speed limits. No one listened. It wasn't until there was a financial penalty of a speeding ticket or seatbelt law tickets that people actually started doing it. And what happened? Well, all of a sudden, lives were saved from motor vehicle accidents. So why did they take that away in the Affordable Care Act when it comes to healthcare? Insurance is risk-based. If you are more costly to insure, then you should pay more. I don't understand it.
Right. And that's the main theme of your book that we hadn't even gotten to yet. And this theme is throughout it, which is, and it's not talked about enough because it's a touchy subject. People don't like to be told that they should be accountable for their actions. But the reality is, and you outline it in some of the data here, a huge portion of our healthcare spending is totally preventable. You have one graph here on cardiovascular disease and strokes. So if you look at total spending, $329 billion, is that per year, I'm assuming?
Yeah.
And then a cost out of that $329 billion, the cost attributed to preventable disease is $263 billion. Cost of unavoidable illness, I'm assuming that's genetic makeup, other things, only $66 billion. That's huge. And you talk about this a lot throughout the book. What are we eating? What's our exercise regimen look like? What are we doing to our bodies?
Well, I mean, it is, it's unfortunate. And, as a physician, I hate it that it comes to me telling someone that they have cancer, that they decide that they want to start living a healthier life. Like, why all of a sudden did we have to get to that diagnosis? Why does it take a massive heart attack for a family to change their ways to start living healthier? Why can't our priority be to be educating Americans and by giving them resources on how to live a healthier life so that we can prevent the disability and morbidity and cost of some of this preventable illness?
It seems to me, being a millennial, that I'm like surrounded all the time by new health fads and ways to work out and ways to eat healthier. And so it's hard for me to understand, one, how you need to be educated on it. It seems to be all around us, the how to eat healthy. It would seem to me that any American who is awake would know that their McDonald's cheeseburger is unhealthy. Now, they may still choose to do it. I still do it every once in a while. But I also noted you, I don't want to get into some of your doctor's recommendations on alcohol intake. You're like, if you have more than 2 drinks, you're drinking too much. And I was like, hey, whatever, leave us alone.
Hey, you know what? Hold on. For me, it's everything in moderation. And,
right.
And Lord knows I am far from a wellness expert, and my book is certainly not a self-help book. But my bottom line is bringing an awareness to people, because I believe in individual responsibility. That's why I think our country is the greatest country in the world. I am opposed to government intrusion. And unfortunately, unless we as individuals start changing our ways to live a healthier life and decrease our cost burden, government is going to be taking over, and they are going to be the ones who are going to mandate what we can and cannot do, and they're going to start being in charge of our health care. And I think that is care. Absolutely the wrong direction.
And
absolutely.
It's rationed care. It's not free health care like they say. No, it's rationed care. But I guess the point I was making was, again, as a millennial, I grew up in this, and it's very different than what I saw a couple of decades ago. And it would seem to me that we should be getting healthier and healthier and healthier, but the trends actually show the opposite direction. So where is the disconnect between everything I see on social media about a paleo diet and all these great ways to eat? And I think they are great ways to eat. But where's the disconnect between that and everybody who continues to eat the wrong way?
Well, it's a bit complex. And the bottom line is that we are in an era of the demand for instant gratification. So I recently found out I am too a millennial. I guess I'm like on the last year of the cutoff, and I had a little moment of sadness when I realized I was a millennial because I like to make fun of them. But that being said,
you're an elder millennial.
So here's the thing. We have to stop looking for quick fixes. Yes, we see all day this fad diet, take this pill. And honestly, it's an era of social media, reality television, the Kardashian clan, that keep telling us, if you do this, you're going to look like this. And all of a sudden, the body that you were born with is just a suggestion, because you just have to use the latest filter or whatever it is to make yourself look better. But as a radiologist, which is what I do, I actually look at people from the inside. And I don't care how great you look on the outside, it's what's on the inside that counts. And that takes more of a long-term commitment to a lifestyle. And the truth is, you may think that everybody is educated on what is best for them, but the truth is they are not. They may think that they're going to the store and some of the things that they may grab, may seem like it's healthy, but it's loaded with sodium or it's loaded with complex carbs. So the one thing that I do believe that the government could do better is to provide those resources in ways to get healthier again. But I know that there's a lot of those stuff going on, but I just don't think there's a big enough awareness. And also it goes beyond just diet and exercise, because of course, most people know if you eat a Big Mac every day, it's not going to be that good for you, but it goes beyond that. It goes to health screenings and certain vaccinations. There are vaccinations that can actually prevent cancer. In Australia, they've essentially eradicated cervical cancer because of certain vaccination uses.
I discovered this recently. I was just amazed. HPV, right? You can actually vaccinate against that. Unbelievable. So the HPV virus is a common virus that most people know about, but what you don't know is, one, it causes over 99% of the cervical cancers, but it also causes a lot of the head and neck and throat cancers. And if you get the vaccine as a adolescent or young adult, it essentially can prevent a lot of these cancers from forming. And these cancers, let me tell you, are devastating. I do the biopsies of the head and neck cancers. The treatments are so invasive. So if you actually have a way to prevent these cancers, it's upsetting that people are not taking advantage of that. But with freedom, that we have the freedom of choice in the United States, which is something, again, I applaud us for. But with freedom comes responsibility. So if you are choosing not to adhere to certain recommendations, not to get certain vaccinations, at what point do we have a frank conversation that says, then you are responsible for the consequences if you've been educated about the benefits of those possible actions? Yeah, and that'll get into a conversation about what the right way is to design health insurance. But if I wanted to ask you, our government's role, I mean, is that little food pyramid that we see at school lunch cafeterias, is that outdated? Seems outdated to me.
Well, it changes a little bit on the percentages. I know I have 3 kids doing distance learning right now, and so I'm well aware what's going on.
You're one of these moms making memes about what it's about the homeschooling life.
If there is a meme about a mother going crazy because she's still trying to work full time, have 3 kids, have a book come out, that's definitely me.
Yeah, there's a lot of memes. I think you would find some good therapy by looking through it. The mom comments throughout the COVID-19 crisis have been the absolute best. I mean, they're just amazing.
Well, I mean, it's true. I think we're all going a bit crazy. But so, one of the things that I highlighted, what you're talking about in the book, was when I looked at these blue zones, and these are these areas where people were living to be over 100 years old. And they're like, well, why are they living so long? And so they looked at the diet and they looked at their lifestyle. And the bottom line is, the quote unquote fad diet of a couple decades ago, the whole Mediterranean diet, that seems to be the best thing. You eat the lean meats, the fish, the vegetables, you still have grains, but, you decrease the complex carbs.
Yeah.
That plus physical activity and social connectivity apparently leads to a very happy life. And so it's not just diet and exercise. You also need to make sure that you're being connected to your community and you still have a place within your community, because feeling that role really goes a long way for mental health. Yeah.
Oh, it definitely does. And I mean, you feel so much better when you just eat right. And I mean, I'm one of these people too, who's always looking for that next supplement, to, just over the counter, just to see what it does, see if it makes you feel any better, whatever antioxidant it is. I realize there's not always a study that would show that it's good. And most doctors will say, hey, just eat good. Don't worry about supplements. There's no proof. But where do you land on that actually? Because I don't trust that necessarily. I can't imagine there's no benefit to having multivitamins.
Well, I go back and forth on it. I will say my caveat is always, if you eat a balanced diet full of fruits and vegetables and lean proteins, then you should be fine. However, you still may be deficient in certain minerals and vitamins. So, for me, I'm not a big supplement taker. I never have been, but I do give my kids some supplements to make sure that they're getting good brain health. But I think as long as you're doing things under a doctor's supervision, or at least someone is aware that you are taking certain things, then I think it's fine, especially if it makes you feel better physically and mentally. Why there can't be any harm in that. But, unfortunately, there are some supplements out there that can be harmful. So a lot of them are actually FDA approved. And, they haven't undergone the proper vetting. So I just would want to make sure that it's not causing more harm than good. But as long as we're sure that it's not causing harm by, you having a conversation with your doctor, then by all means, whatever you want to do that you think is going to help you, I'm for.
Good.
Did you like that? That's very politically correct.
Very politically correct. Do what you want. Just don't hurt yourself, and get some exercise. I mean, that's the big thing. That's what I tell some of these politicians making silly videos with ice cream and extra mayonnaise on their tuna melt sandwich. Why don't you do a workout video, buddy? Let's get some of those out there. I do those every once in a while. Maybe I should do more. Okay, so you've got 3 chapters here that hit 3 different big problems in America that are most certainly driving up our healthcare costs and just our general downward spiral of overall health. Cancer, opioid epidemic, and the mental health epidemic. Which one do you want to talk about the most?
Well, we can start. I mean, obviously, I exhaust talking about cancer because that is my day to day. But everyone knows someone who has been diagnosed with cancer, or if they've been diagnosed themselves. And I am, a big concern for me is that I just want to make people know that there is some cancer that can be prevented. And for all of the cancer that cannot be prevented, early detection is going to be key. All of these things are within that person's power to do, as long as they're, staying in touch with their physician and they're undergoing their necessary screenings. So I prefer to transition to mental health and opioid, because although the opioid crisis makes a lot of...
Actually, real quick, there's one thing you point out in your book, which I found to be very surprising, which is that millennials were twice as likely to develop 6 different types of cancer as were baby boomers at the same age. The reason this surprises me so much is because people our age don't really smoke. Smoking was much more prevalent back in the baby boomer era. Now, obviously, that's just one of many things that causes cancer. For us laymen who are just hear the news all the time, it seems like everything causes cancer. But why is that? Why are millennials actually more likely to develop cancer these days? What are we doing differently?
Oh, well, I mean, unfortunately, this is a devastation in the cancer industry, because we have made such headway into lowering the mortality of certain cancers through early detection, like mammograms and lung cancer screening and colonoscopy. We've also been able to decrease lung cancer because of decreased smoking and some immunotherapies. However, all of a sudden, Americans' waistlines have gotten much larger, and our average body mass index, or BMI, is higher than it's ever been. And not just it's higher than it's ever been, it's higher than anywhere else in the world. So unfortunately, obesity has contributed to not only a rise in heart disease and diabetes and metabolic syndrome, like people kind of know about, but it also increases the risk of several cancers. And it's now directly related to the rising incidence of certain cancers. And that is,
really?
It is such a letdown for the researchers and the doctors and the scientists, everyone who's really working on the quote unquote cure for cancer, because we were seeing decreasing mortality trends with certain cancers. And now all of a sudden, we're seeing some of them tick back up again. And the explanation is because of the excess body weight of people. So think of it this way: those fat cells in your body, we all have them. I've had 3 kids. I've had some too. Those fat cells, not only do they produce certain hormones, but they also cause a state of inflammation. And that state of inflammation lowers your immune system, which is why we're seeing higher mortality in COVID patients that tend to be obese. But it also can cause cancer. Yeah. And because of that, that's why now we're seeing increased cancer. If people were educated at a younger age, if they started taking actions earlier on, those diseases, including cancer, could have been prevented.
Yeah. So, I mean, it really is the same: diet, exercise, moderate use of your excesses, of your vices, as we would call them. And you'd be much better off. Because another question I have, I don't know if you have this off the top of your head, but But countries like South American countries, European countries, the smoking rates are much higher than they are in the United States. Do they have the same rates of cancer, or are they about the same because they're thinner?
So that's actually a great question. And one thing that I did look at, and the truth is they have, the most common cancers being breast cancer, lung cancer, and colon cancer. Those are all about the same. But when you start looking at different cancers, such as liver cancers, other ones that are directly related to obesity, United States tends to have a higher in some of those, whereas China has like a higher gastric cancer, but that's been attributed to their intake of nitrates. So everyone kind of has their own thing, but the main cancers that we really talk about, they tend to be similar in different areas of the country. It's just when you really look at the fine details, do you see the concerning trend of obesity playing a part?
Yeah, because they shouldn't be similar if other countries smoke so much more. I've been to other countries. People smoke. I mean, I went to high school in South America. Everybody smoked, like everybody. Okay.
Yeah, right.
And I think they still do. So, the rates just shouldn't be the same, but you're saying they kind of basically are, even.
Well, here's one way to look at it. So because everything right now goes back to COVID. Look at COVID-19. When it was just in China, they were reporting high fatality rates in men, and they were attributing it to the high pollution levels there, that the men have lung disease because of the pollution. And so we're like, our initial thoughts were, okay, so it's not going to be nearly as bad here because we have less pollution and we smoke significantly less than those in China do. But what happened here? We started seeing a lot of fatalities here, and then the studies were coming out, and no, it wasn't smoking. Now for us, it was obesity. So you always have your reasons of why things are happening, but the reasons just may be different.
Yeah.
So we beat them on pollution. I mean, we beat them on a lot, but just in this scenario, we beat them on pollution. We beat them on smoking trends. But our obesity epidemic was our Achilles heel. If we just didn't have excess body fat and that so much chronic disease, we would have been much more prepared for COVID-19.
Yeah. Okay. And that is depressing. Getting into the mental health epidemic and opioid epidemic too, you have a lot to say about that and perhaps what we can do to improve our stats on this as well.
Well, so, I try and talk about mental health in the sense that it is underrepresented when it comes to discussions, when it comes to healthcare. Obviously, you, quote unquote, are on the front line, so you hear more about it than a lot of people. But the truth is, the stigma of mental health is still very real. And people don't talk about anxiety and depression and bipolar and everything else. But the truth is, Americans are having a growing mental health crisis that we're really only beginning to understand. A lot of it, just like heart disease, just like cancer, can be attributable to your genes, and there's not much you can do about. But a lot of the new growing mental health is because of our surroundings. Look at social media. Look at what's happening right now while we're all stuck inside of our house. Mm-hmm. I mean, we are making certain situations that are promulgating mental illness that will lead to increased suicides and overdoses, and overall decreasing people's contribution to society, because if you become severely mentally ill, you're not able to function.
No, it's absolutely right. And we have seen an uptick, especially in the Gen Z generation, of anxiety and, self-reported anxiety. Suicide rates, especially for young girls, have gone up. I believe that's correct. And, there's a real problem. And the only difference really being in this generation versus even the millennial generation, where you and I, if we're elder millennials, we kind of grew up in analog and then, became adults during digital. But Gen Z was pure digital the whole time. And they really have this warped sense of reality because of social media. And it seems obvious in hindsight now that is contributing to an increased sense of anxiety.
Well, I mean, I'm raising 3 boys, and all I can say is thank goodness, because I cannot imagine being a girl growing up right now. Because, as I already mentioned, between the filters and the plastic surgery and the facial contouring, I mean, no longer can you just be satisfied with what your appearance is on the outside. And unfortunately, all of this attention is making people only care about the outside and not the inside. But, my oldest son just went off to college, and we went through the whole college admissions process. And a year before him, a senior killed himself because he didn't get into his father's alma mater. And I couldn't help but think to myself, like, how did he get to that place where he felt that his life wasn't worth it because he didn't get into one college? And I feel like as adults, we have put so much pressure on ourselves and on our children that we are continuing to try to impress someone. And I don't actually know who we're trying to impress. But at the end of the day, isn't it really just about having a happy and healthy child? Does it really matter, certain colleges? And I just think that we have really skewed, our priorities as a country.
Yeah, and I think the right message for people, I'm going to steal a chapter from Jordan Peterson's book, which is compare yourself to who you were yesterday, not who everybody else is. That's the right way to go about things. You take accountability as you should, as you talk about a lot. But you have to take accountability for who you are and what's within your control, and put more things in your control than maybe you did yesterday. This is the other issue. I think a lot of people are willing to believe that a lot of this stuff is outside their control. You talk about the obesity epidemic, and you can't really talk about it. You get hammered. It's politically incorrect to talk about it. God knows, I'm talking about it right now. I'm a politician on my podcast. But you have to talk about it. You just have to, and you have to let people know that they do have control over it. The opioid crisis is another really big one. I understand this one. I've been injured so many times. I know exactly what it's like to be on pain medication. I know exactly what that does to your brain. The difference is I was never exposed to it until later in life, and my late 20s. And I think there's some research that shows that if you were exposed to an opioid, Oxycontin or something earlier on, maybe as a teenager, because that one drug dealer got it into your school. And I know this has happened because, my wife is from Maryland. Maryland has a real problem with this. And like many states in the Northeast and in the Midwest. And it just takes that one drug dealer to give that access to kids. And once they've had it at that young age, it really rewires your brain. And they might get off of it, but then 10 years later, they'll overdose, even though they have a great life, a good job, a family, and they'll overdose. And it's one of the saddest things that's it's crushing our country right now.
No, absolutely. And the opioid crisis has affected all parts of America across all socioeconomic groups and regions. And on average, I think it's about $20 billion is spent on hospital care for the opioid overdoses every year in the United States. And the bottom line is that this is crushing our nation. And, President Trump got a lot of heat for wanting to be tough on the border, but when you identify that a large amount of it is coming from a certain border, you have to take drastic actions, or else this will continue to crush us. Similar to what happened with the travel ban. You cannot worry about the criticism that will come when you're trying to protect your nation. And, I applaud President Trump in that sense of trying to tighten borders when it comes to drug importation, but also, the need for an overall awareness and making sure that, as you mentioned, lifelong access to treatment is available, because an addiction is lifelong. And unfortunately, there is a massive stigma associated with those who have become addicted to opioids, and it is very tough to get past the stigma.
Yeah, and the other problem I see is the pendulum swinging too far the other direction, where we've tried to basically prevent access to opioids at all, which I hear from patients that really need it, that it's really tough on them because maybe they're using it responsibly and they need it, I guess. And then the problem becomes, well, they can't get it, and then they'd use heroin, which might be laced with fentanyl, and then that's what's actually causing the deaths. Very few people, from the data that I see, are actually overdosing from Oxycontin itself.
No, you're absolutely correct. And I think 80% of the people who wind up on heroin originally started out on prescription opioids, legal prescription opioids, but whether they got it from their grandmother's medicine cabinet or they got it from their wisdom teeth surgery. But you are absolutely right. I mean, one hand, when the government starts to step in and they go, full throttle. All of a sudden, no one can prescribe opioids. There are massive restrictions. There are massive administrative regulations and educational regulations on physicians that are just adding to that oversight and burden that is driving so many physicians and nurses away from our healthcare system.
So we haven't gotten yet to a lot of the solutions for a lot of these things. I want to be respectful of your time too, because we're about at an hour. Do you have more time?
I do. I have a little bit of time.
Okay, then let's get to some of the solutions that you talk about. You have a whole chapter on the ACA, call it a self-destructing system. So what are the problems with the ACA and how do we get out of this mess? Because it's pretty obvious that as soon as the ACA was passed, our premiums started to go up. There's a lot of reasons for that, primarily the pre-existing conditions part of it, which we agree we should protect people with pre-existing conditions. It's just the way that the ACA did it made healthcare premiums go up. So let's start with that. What's the best way to protect people with pre-existing conditions while also allowing people to have some kind of affordable premium to pay?
Well, there is no black and white solution here. And although I offer some thoughts on it, I think it is obviously far more complex than one book can conquer. But the truth is, people, as I mentioned, 60% of Americans live with some form of pre-existing condition right now. 40% actually have two or more. And so it is not fair to say that you are not able to have affordable health insurance because of them. And so I would like to get back to a place where we are actually protecting those with pre-existing conditions, but we're also incentivizing others to live a healthier life, to maybe lessen the burden of their pre-existing conditions if possible, but also preventing any future ones. And so, and so in that sense, that's me being, when you talk about expanding Medicaid, Seema Verma is a very smart woman, and she implemented some policies in Indiana and attempted to bring them to a federal level, where we wanted to make sure that people had access to care. But doing so, she wanted to get them involved in some of the cost sharing. And that goes along the lines of what I keep talking about, is that everybody needs to have some stake in the game. So if you want to have access to healthcare, then you need to, I feel like I just jumped the topic there. I went from pre-existing to Medicaid. So I'm going to start with Medicaid and then go back to pre-existing.
Yeah, it's related.
But so in terms of Medicaid, our lower income, they have to have access to medical care. And whether that's in the form of Medicaid or whether they show up at an emergency room and are able to undergo emergency services, that can be debatable. But they have to have some stake in the game. So they cannot just be expected to have free health care, free health insurance, and not be expected then to overutilize that. Because if they don't have a copay, then they can go to the doctor anytime they want, and they may be going too frequently when maybe they didn't necessarily need to go. And I think that if you give them just a little bit more stake in it, then people do start to make smarter choices. Or maybe you say you have to hit certain metrics of wellness to be able to stay on your Medicaid program. So, if someone is morbidly obese, or I talk about in my books, Medicaid recipients have a higher cigarette smoking rate. If you have your blood test or your urine test that shows that you have tobacco in your system or nicotine in your system, or you have your weight check to show what your weight is, and that's your baseline. But then maybe your physician can lay out for you a plan on how you're going to stop smoking or how you're going to lower your weight. And if they hit that certain metric, they can continue to stay covered by the Medicaid program. If they don't hit that metric, then there's potentially a warning system. Or maybe at that point, they need to actually have more cost sharing because they are costing the system more by not meeting certain wellness metrics. And, we can speak on this for days, for weeks at a time to come up with certain solutions. But by involving the individual into the process, I think that is the way to help lower that care. And that can be the same as it translates into pre-existing conditions. Your pre-existing illness is covered by your insurance without an increase in your premium, as long as you're hitting certain metrics and you're doing what you can to lessen the cost of care in terms of other facets, because we're all going to go to the doctor, and the minority of us are going to walk away with a 100% clean bill of health without one recommendation on something we can improve upon. And so the doctor can be tasked with that responsibility of, okay, how can this person be just a little bit more healthy? You come up with a plan for certain metrics that can be met, whether it's losing weight, stopping smoke cigarettes, increasing physical exercise, whatever it is, lowering your cholesterol level, whatever it is, meet those metrics, and you don't have to pay increase for premiums or your deductible. Don't meet those metrics, and then it's quite possible that your health insurance will go up because, again, you are more costly to cover. You don't want to get your mammogram? Fine. But then when you are diagnosed with a more delayed cancer diagnosis, that may be on you because it is more costly to treat at that time. But as long as you were educated on the benefits of early detection, then that, again, that's your responsibility to do what is right to decrease the overall cost of care.
And is there a better way to think about insurance as a whole? Maybe dividing it up into, primary care, which, and you can really make the analogy to how car insurance works. We fill up our own gas, we fill up our own air in our tires. We change our oil. We don't ask insurance to do that. We might even fix our own cracks in the windshield. But then there's the next step, which is a little bit more intensive care, but not necessarily cancer, not necessarily a serious illness or injury, which would require care beyond primary care. And then there's the real costly illnesses, such as cancer or just chronic illnesses that are very, very expensive. And is there a better way to sort of divide up how we think of insurance for all three of those categories?
Absolutely. And some of it was birthed in your state of Texas, talking about direct patient care. When it comes to primary care and preventative wellness, that really shouldn't be under the same health insurance as everything else, because you're doing what you can to prevent illness by going to your primary care doctor. And similar, you gave a great example of the car, and I mentioned that a little bit in the book. We go and get oil changes so that our car doesn't break down, and then we have to use our car insurance for whatever. You do certain wellness and go to your primary care doctor so something bad doesn't happen. But if some detrimental illness does come, that's when you have your health insurance to step in and help. Or if you need to go to the emergency room because you fall and break your arm, that's what health insurance was all about. For some reason, over the last several decades, everything has gotten lumped under the health insurance, which is why we've given them so much power over us. And unfortunately, that has just caused what started out as a very small Blue Cross Blue Shield has turned into these Goliath healthcare systems. And unfortunately, in my opinion, has really decreased the quality of care because it is no longer a doctor-patient relationship. It is between the health insurance company and the physician, and the patient is left in the dark.
Right. And you point out as HSAs are a great way to move forward in that kind of system. That means health savings account, which basically means everybody would have an account, and you put money into that account, or if you're poor, the government can subsidize that account, but it's a tax deductible account that is for healthcare spending. I would love to see that available to pay for, you mentioned briefly, direct primary care. And just for listeners, I've talked about this before on this show. Direct primary care means that you as a primary care physician, you don't deal with insurance. You have a subscription service, and on average, it can be about $75 a month. This is not expensive, and your group of patients has basically full access to that primary care doctor. And there's really no extra copays. There's a list of services that are included in that subscription fee. And it's an amazing model. I'd like to see it expanded rapidly throughout the country. I think that's the way to do primary care. Of course, it doesn't fix everything, right? It's not insurance. It's not meant to be insurance. We have to have different, but it makes the insurance problem a lot easier to fix. And maybe allowing individuals to have some portability with their insurance, allow them to pay for it in a tax deductible way, the same way that our employers are able to do, would get us in that direction, moving forward in that direction. Then you talk about risk pools. So for the big ones, right? Like the big expensive procedures and catastrophic injuries or illnesses that are just can be in the millions of dollars. That's right now, insurance pays for that, or at least they're supposed to, of course. And if somebody isn't insured, then the hospital incurs that cost and they have to be reimbursed in other ways, or they just charge everybody else, $76 for Neosporin, as you mentioned somewhere else in your book. That's one of the reasons. That's one of the reasons you see crazy bills like that, is because they're making up costs for the uninsured. And so, is there a better way to do the really expensive stuff?
So one thing that stands out, what you're talking about, is like transplant medicine. If someone requires a transplant, that is an extremely expensive operation, followed by lifelong visits, scans, as well as medications. So yes, I believe that the 3 levels of insurance should be, your direct primary care, which is not necessarily insurance, but that's more of your preventative wellness. And then you also have kind of everything, like going to the emergency room, or you get a cold or anything that requires certain care. But then these really expensive kind of dramatic diseases that can occur should fall under line of the high risk pools to provide access for care for high cost cases. And, these can be consisted of, private and, publicly funded plans. If the really expensive illnesses were taken out of the general insurance pool and put into their own pool, then all of a sudden the cost of care for the majority of individuals who don't have such costly illness will go down. And so the focus should then be on funding those high-risk pools, as opposed to needing supplemental coverage for everybody else in the general pool. Because right now, through the Affordable Care Act, everyone's needing supplement because no one can afford their plans anymore. But if you actually started to tease certain things out, then all of a sudden it would become a lot more affordable for the far majority of people. And then you only have to worry about how you're going to fund those that require more costly care and not have it disrupt the affordability of the majority of the population.
And as I understand it, many states were moving towards that risk pool model. And then the ACA came, Obamacare came, and because of the way that law is written and how it seeks to solve the problem of pre-existing conditions, it removed any incentive to have a risk pool at all. It basically just took a hammer to that idea.
Well, the Affordable Care Act was a weekend attack that socialized medicine, just under the guise of being called the Affordable Care Act. They really tried to move it to cost containing, and not cost containing, but offsetting costs by everybody else paying. And that's really the model of socialized medicine. Essentially everyone pays the same amount, no matter how healthy you are, how much you're actually costing the system. Other people are going to offset the care for others. And unfortunately, that is why I believe that a lot of people's health insurance went up and it became unaffordable, because they didn't really tackle it in a risk-based setting.
Yeah, no, that's very true. So I guess we'll end it with this. Top 3 incremental solutions that you think are somewhat within political reality that we could do to drive down premiums while maintaining our innovative capacity.
Well, I think the key is to focus on the demand side of the equation. And we know that Americans and humans in general really respond to incentives, positive and negative. I like to focus on positive incentives. And so I believe that moving forward, that there needs to be some incentive for people to actually try and live a healthier life, whether it is through some cost reduction of care because they're hitting certain metrics. That's, again, the biggest problem in my eyes with the Affordable Care Act is it took away incentivizations for living a healthy life. Everyone's having to offset the cost of others. So focus on the demand side of things.
And what it tried to do is force people to buy it, force young people, healthy healthy people like us to buy into it with the mandate. A lot of us just said, well, I'd rather just pay the fine, or call it a tax, whatever you want to call it. And then, so they still didn't get young, healthy people into the system, even though that was the intention.
Right, absolutely. Also, we need to have less government intrusion into the health system, in the sense that the legislators and hospital systems seem to be in cahoots, and it's really squeezing out physicians and the people who have access to patients. And, a lot of this is being seen with the out-of-network legislations. And at the end of the day, the health insurance companies have gotten far too much of a hold on the healthcare system. And I think it is really important to get back to where physicians can actually make medical decisions and not be forced into formularies and certain insurance plans.
Yeah. Is that more of an outcome-based kind of model as opposed to the fee-for-service? Is that what you're getting at, or is that a different discussion?
So, it is difficult. It's really difficult to say. Yes, we want to go towards outcome-based model helps physicians. It weans out those that are not practicing well or who have poor outcomes. But the problem is, if you completely go away from the fee-for-service model, you, again, like what we saw with COVID-19, where legislators were able to say what was an elective and non-elective procedure. The problem with going completely away from fee-for-service is take a very high-risk scenario, like a ruptured brain aneurysm. Mm-hmm. If someone were to intervene, so if you don't intervene, the mortality rate is over 90%. If you do intervene, the mortality rate is still about 50%. But at least you have a chance of saving the life. So What if the person then does the intervention and they die? Does that mean that physician who went and did the intervention they should not actually be reimbursed for leaving in the middle of the night to go care for this patient? That is one of the problems when you completely go away from the fee for service.
It's got to be a smart mix.
Yeah, and unfortunately, when the government starts making these rules, no offense, but it's not necessarily a smart mix.
I don't take offense, but you don't have a lot of nice things to say about the insurance companies either, and so people would counter argue you're because you're against single payer, but people would be like, well, how can you be against single payer when it's obvious that the insurance companies aren't acting as good moderators or good third party insurers either? Shouldn't we just allow the government to do it? And you address that in your book as well.
No, I don't think we should allow either of these Goliaths to take over the health care profession. I think whether it's a private insurance, huge corporation, or the government, they're still not the person who should be charged with the task of deciding what is right and wrong when it comes to caring for patients.
Well, and there's this notion out there that the government would just pay for what the doctors would need and that it would all just work out really well. Of course, that's not what we see in countries with socialized medicine. We see severe rationing occur instead. And also people should note that doctors don't like dealing with Medicaid and Medicare, right? It's if you're looking at as far as regulatory burden and trying to fill out the right paperwork and make your case for that reimbursement, am I correct in saying that doctors really don't like dealing with Medicaid or Medicare either?
Oh, of course not. And it's very difficult. Insurance in general is difficult, but here's the difference between dealing with the private insurance and Medicare and Medicaid. At least going through the struggle to get reimbursed by the private insurers will actually pay for the bills to keep the medical practice open.
Yeah.
If a physician is going in for an emergency surgery and only doing it on Medicaid patients, it will not be enough to keep that practice afloat.
So you got to fight for it through the regulatory red tape. And also when you finally win that battle, they're still underpaying you.
Yes, exactly.
Yeah. So that's not, and by the way, anytime you hear a single payer legislation proposed, it doesn't change the actual reimbursement rates for Medicare. It's still, if it did, it would be much, much more expensive. It's already really, really expensive and would probably double or triple our taxes. But, if you actually wanted to reimburse doctors and hospitals at rates that would make them whole and keep the supply side of our system whole, then you'd have to increase the cost even more.
Well, absolutely. But overall, the physicians, nurses, hospital systems would all be taking a pay cut to go to the single payer model. And I've never heard of a pay cut as a means to improve the quality of anything.
I make that point quite a bit. You're in New York City, and there's not a lot of conservative people in New York, but you're in the medical community in New York, and so what's your general take? How do doctors and nurses view the single payer debate?
I think what is said publicly is very different than what is said privately. And I believe that, again, it's very easy to sound like a bad guy if you say anything other than, of course, I want everyone to have access to healthcare in a public format. I don't believe that a lot of people truly understand it. You have to remember, we all went to medical school, nursing school. We didn't really study policy. We didn't study business administration. A lot of us, our knowledge is really just focused on, the mind and body. I'm not trained in health policy, but I got involved in legislation even while I was in training, and I find it very intriguing. And I found early on that I can only see so many patients in one day, and I would touch so many more people by getting involved in some of the advocacy.
Mm-hmm. No, that's very interesting. You definitely hear different opinions from the medical community itself, but we'll continue to have that debate. Anything else you want to add? I know I've taken up a ton of your time, and I really appreciate it.
No, I'm just very thankful to be on, and I love everything that you're doing and that you're about, and I think that you have been a breath of fresh air since coming to Washington.
Oh, tell me more. Thanks. We could do another 10 minutes if you're just going to compliment me.
No, I actually have to get back to work. Shocking.
Good. Yes, I would appreciate